So when I think of chronic pain, I think of like physio appointments. I think of having to exercise. I think of having to, you're on the mend for a few years until you fix your injury. But what a lot of people don't understand is there's an emotional side to chronic pain, and that's what you help your clients with.
Yeah, I love that you asked this question about what pain is like. When you think about pain, we think about going to physio appointments, taking care of it, having to do physical things. But the
Mhm.
reality is that pain is just as equally emotional as it is physical, and this emotional piece is really invisible. This is what most of my clients talk to me about, and we work with the emotional aspects of pain, which are depression and anxiety. These
Mhm.
two go hand in hand with pain. It's very difficult when you are in your body and your days are either pain days or not pain days. You're
Yeah.
either having a good day or a bad day, and you're also trying to manage your life everywhere else around there. So the emotional aspect of what it's like with that struggle, feeling isolated, just trying to survive the day and appearing that everything is okay, and how much energy that can take. We're
Mhm.
all high functioning people with chronic pain as well. So this is all the micromanagement that happens on a daily basis, from the moment you wake up to the time you go to sleep, all the emotional rides that you can go on during the day, whether it's anxiety about the future. Will I be able to do this tomorrow? I better
Absolutely.
get this done
Yeah.
today because tomorrow might be a pain day. So we
Yeah.
have a higher rate of burnout, for example,
That's right.
because of this, because we can have really good pain days where we go full tilt, and then it will take us 3 to 4 days to sometimes even recover. But objectively, it looks like things are fine, right? We can go tickety boo, do things, but the reality is that the emotional aspect of it can take a very big toll on how we feel, and we need to take care of that to help bring you to a place where you can experience a better quality of life with those
Right.
emotions, so we can get to a place where those emotions can feel more balanced, but they
Mhm.
are very valid.
Um, and so you brought up something about relationships. And what I love about that is I know you also support couples and partners and spouses who live with someone who's dealing with chronic pain. What does that emotional side of chronic pain look like for the other person?
When you're taking care of someone who has chronic pain, you become a caregiver on some levels. And that can be very tricky in a
Mhm.
relationship, because you're trying to be intimate, you're
Yeah.
trying to be huggy, and you're also trying to be connecting on day-to-day issues, yet you're also monitoring for how they're feeling and how they're physically feeling, and also feeling the effects of their moods. And if our partner who has pain is feeling depressed that day, we have to find ways of picking up ourselves and also try to help our partner. So that can take a big emotional toll also on partners. So when I work with couples, we talk about that. We can talk about what it's like, that dance between I'm your partner, I'm your lover, versus can I help you walk to the bathroom with your
Yeah.
crate. Like, it's so there are many layers where we become so vulnerable, yet we also want to boundary some things, and we
Mhm.
don't want to expose some of the, say, dark sides of pain to our partners when we have pain. So the person with pain sometimes maybe hides it or doesn't share. So there can be a lot of factors that affect the couple, and this is the work that we do in session.